Hi everyone! Today I will be discussing HIV and AIDS and the opportunistic infections that can arise from HIV and AIDS. So firstly, we'll do a short introduction into HIV. The human immunodeficiency virus attacks the body's immune system, specifically CD4 cells, or also known as T cells. Scientists believe that this virus originally came about from chimpanzees in Central Africa who carried the simian immunodeficiency virus, SIV, and was transmitted through the process of hunting for meat and coming into contact with their blood. SIV is a virus closely related to HIV. The disease then slowly spread across Africa and was later introduced into other parts of the world. The first case of HIV in the United States was first reported in June of 1981. The first cases were seen in gay young men and were then noted in injection drug users. HIV received a lot of negative media and at first was called the gay disease by many reporters, which then put a big strain on the gay community. Next, we will move on to talk about the mechanism of HIV. Firstly, binding and fusion. HIV infects the white blood cells known as the CD4 cells, which are vital in fighting off infections and diseases and that keep us healthy. Once attached to the CD4 cells, it releases its genetic information. So then we move on to reverse transcriptase. HIV will convert its genetic material into HIV DNA. This new DNA then enters the nucleus of the host cell and takes all control of it. Then transcription and translation. The newly infected CD4 cells produce HIV proteins that are used in the process of creating more HIV particles inside that cell. Assembly, budding, and maturation. The new HIV is put together and released from the CD4 cells into the bloodstream to infect other cells, and the process continues to repeat until all cells in the body are infected. To the right here, I have a small illustration for better understanding of what this process may look like. Now we will move on to transmission. So HIV is transmitted when coming into contact with an infected person's bodily fluids. These bodily fluids can include blood, semen, vaginal fluid, breast milk, and fluids from the anus. The virus has opportunity to enter the bloodstream through a mucous membrane like the anus, sex organs, linings of the mouth, or broken skin anywhere in the body. Sex without a condom presents a big risk to come into contact with HIV. The virus may also be passed from mother to baby during pregnancy. HIV can also be passed from mother to baby through the mother's blood during pregnancy or through the process of childbirth and through her breast milk when breastfeeding. It is possible to acquire HIV through a blood transfusion and an organ or tissue transplant, but the risk for this is small because most countries now will test blood products for HIV beforehand. Sharing injection equipment used to prepare and inject drugs is also a big way of transmission. There are many misconceptions and stigma that surround HIV to this day. HIV cannot be transmitted through the sharing of dishes, saliva, tears, sweat, shaking someone's hand through the air, sharing toilet seats, closed mouth kissing, hugging, and mosquitoes, ticks, and any other insects. Within 2 to 4 weeks after an initial infection, people may begin to experience flu-like symptoms, and they can last anywhere from a few days up to several weeks. The first stage of HIV infection is called acute HIV infection, and this can show symptoms of fever, chills, rash, night sweats, muscle aches, a sore throat, fatigue, swollen lymph nodes, and mouth ulcers. In stage 2, it is called clinical latency, so this will be a chronic HIV infection, and the virus continues to multiply in this stage, but at much lower levels. People may not even feel sick during this stage or present with any symptoms. Without any treatment, infected people can stay in this chronic HIV infection stage for 10 or 15 years. The only way you can truly know you have HIV is to get tested. You cannot base it off symptoms alone, and everyone can experience different symptoms. The third stage of HIV is AIDS, but we will talk about that later. HIV can be diagnosed through multiple blood and saliva tests. The first test being antigen testing. This usually involves drawing blood from a vein. HIV antigens can be detectable in the blood within a few weeks after your initial exposure. Next, we have the antibody tests, and these tests will look for HIV in the blood or in the saliva. Most of the rapid HIV tests are antibody tests, which include the self-tests that can be done at home. These tests can take 3 to 12 weeks to be positive after an exposure. At-home kits can be done by rubbing your gums with a swab and then placing the swab into a vial of liquid. The test strip on the swab will determine if you have HIV or not. A home blood test kit will provide special instructions and materials needed for collecting a sample of blood by sticking your finger with a lancet. This blood sample will be placed on a special card that is sent to the lab for diagnosing. Lastly, we have nucleic acid tests, and these will look for the virus in your blood, which can also be known as your viral load. These tests also consist of a blood draw from a vein. Nucleic acid tests will be the first test that will come back positive after an HIV exposure. On the left here, I shared an interesting fact that in the United States, every 9.5 minutes, someone is infected with HIV. If you receive a positive HIV result, doctors will look to figure out which stage of HIV you are in, and also in order to determine proper treatment. A CD4/T cell count, even without any symptoms, an HIV infection can progress to AIDS if the CD4 cell count drops below 200. The next test is a viral load test, and this test will be able to measure the amount of virus present in the body. After beginning treatment, the main goal is to have an undetectable load. This will then reduce chances of opportunistic infections. A drug-resistant test will also be administered because some strains of HIV are resistant to certain medications. This test will help the doctor determine an appropriate treatment plan if you are resistant to some medications. Many doctors will also take precautions and test for other infections such as hepatitis B or hepatitis C, sexually transmitted infections, urinary tract infections, tuberculosis, liver or kidney damage, and cervical or anal cancer. Epidemiology of HIV. So this is one of the world's most serious health and developmental challenges. There is currently no cure for HIV, and many people do not have proper access to treatment. 38 million people currently live with this disease, and 1 in 5 people with HIV are unaware of their infection. We can see here from this 2020 data provided by the World Health Organization that even children under 15 can be diagnosed with HIV, and that number was 1.7 million just last year. Treatment for HIV consists of antiretroviral therapy, which are medicines that reduce the amount of HIV in the body. It is important to start treatment as soon as possible after receiving a diagnosis. These medicines will keep viral load low and CD4 cell count high. The most common medications include Atripla, Complera, Acentris, Norvir, and Truvada. Most people under this therapy can get their HIV under control within 6 months. Taking HIV medicine will not prevent transmission of other sexually transmitted diseases. If you have an undetectable viral load, you have effectively no risk of transmitting HIV to an HIV-negative partner through sex. Having an undetectable viral load also helps prevent transmission from mother to baby. If a mother with HIV takes HIV medicine as prescribed throughout her pregnancy, labor, and delivery, and then gives HIV medicine to her baby for 4 to 6 weeks after birth, the risk of transmitting HIV to her baby can be 1% or even less than that. Taking HIV medication as prescribed is important because it helps prevent drug resistance. Drug resistance develops in people with HIV who are inconsistent with taking their medication because the virus has opportunity to mutate and will no longer respond to certain HIV medication. AIDS is the acquired immunodeficiency syndrome caused by HIV. This also damages the immune system. The third stage of HIV is AIDS when the CD4 cell count drops below 200 and the immune system is badly damaged. HIV will progress to AIDS if proper medication treatment is not followed as directed. The disease mechanism for AIDS is the same as HIV, as it is just a prolonged result of living with untreated HIV. The symptoms of AIDS are more severe, and they can include rapid weight loss, extreme tiredness that is unexplained, diarrhea that lasts over a week, sores of the mouth, genitals, or anus, a recurring fever, profuse night sweats, pneumonia, prolonged swelling of the lymph glands in the armpits, groin, or neck, memory loss, and depression. There are also neurological symptoms of AIDS that can include encephalitis and meningitis, also retinitis in the eyes, pneumonia and tuberculosis in the lung, tumors of the skin, and chronic diarrhea. A diagnosis for AIDS is the same as when being tested for HIV. A person is considered to have developed AIDS when their CD4 cell count has fallen below 200 cells per cubic millimeter. For reference, a healthy person's CD4 cell count is between 500 and 1600. Without HIV medicine, people who develop AIDS will typically survive for about 3 years. AIDS-related deaths have actually been reduced by 64% since the year 2004 and by 47% since 2010. Around 680,000 people died from AIDS globally in just 2020 alone. This is compared to 1.9 million in 2004 and 1.3 million in 2010. The mortality rate has declined to 53% in women and 41% in men since the year 2010. Treatment when HIV has progressed to AIDS still remains the same. It is important to still take the antiretroviral drugs as prescribed. Next, we will move on to talk about opportunistic infections in HIV and AIDS. These are illnesses that are capable of occurring more frequently and become more severe in people who are already diagnosed with HIV. Opportunistic infections are less common in people with HIV because of how effective HIV treatment has become recently. People with HIV can still develop these infections for a variety of reasons. One being they may not know they have an HIV infection. And number two, if they don't know they have an HIV infection, that will mean they're not on HIV treatment. And three, HIV treatment may not be working properly for them. The first opportunistic infection in HIV and AIDS we will talk about is candidiasis, which is also known as thrush. This is caused by infection with a fungus named Candida. It affects the skin, nails, and mucous membranes throughout a person's body. The Candida fungus causes trouble in people with HIV, mainly in the mouth and vagina. This infection is only considered an opportunistic infection when it causes severe infections in the mouth, vagina, or it begins to develop in the esophagus or lower respiratory tract. Symptoms of this can include itching and irritation in vagina, tiredness and fatigue, recurring urinary tract infections, sinus infections, joint pain, and digestive issues. A diagnosis for this can be through acquiring a blood sample or sample from infected body site to be tested in the lab. The treatment for this mostly includes antifungal medications. On the right here, we see what this would look like on a person's tongue. Next, we have cystoisosporiasis, which is caused by the parasite Cystoisospora belli. It is capable of entering the body through contaminated food or water. The symptoms include fever, a headache, abdominal pain, weight loss, vomiting, and diarrhea. A diagnosis can be made through the identification of oocysts in the stool or intestinal biopsy specimens. The treatment for this are prescription antibiotics like Bactrim, Septra, or Cotrim. People who have diarrhea should also drink plenty of fluids in order to prevent dehydration and should also get plenty of rest. On the right here, we have what the parasite Cystoisospora belli looks like. We then have tuberculosis. This is caused by the bacterium Mycobacterium tuberculosis. It is able to spread through the air when a person with tuberculosis coughs, speaks, or sneezes. This will cause a severe infection in the lungs. Symptoms of tuberculosis include weight loss, fever, cough, fatigue, and night sweats. A diagnosis for tuberculosis could be done through a tuberculosis skin test, a blood test, a chest x-ray, or a CT scan. It will also include sputum testing for the tuberculosis bacteria. Treatment for tuberculosis involves antibiotic use for 6 to 9 months. Some antibiotics used to treat tuberculosis include isoniazid, rifampin, ethambutol, and pyrazinamide. Another opportunistic infection that can arise from HIV and AIDS is known as herpes simplex virus. This particularly common virus does not really cause major problems in most people. It can cause painful cold sores in or around the mouth and painful ulcers on or around the genitals or anus. People who have severely damaged immune systems from HIV and AIDS can develop infections in the bronchus. They can also develop esophagitis and pneumonia. The diagnosis for this is very routine and can usually involve just a visual examination of sores. A swab test or a blood test can also be done to further confirm the diagnosis. Treatment is antiviral medications such as acyclovir or valacyclovir. No treatment can cure herpes simplex virus, but it can be controlled. Next, we have pneumonia, which can be an infection in one or both of the lungs caused by a variety of different bacteria, viruses, and fungi. One of the most common causes of pneumonia in people with HIV is an infection with the bacteria Streptococcus pneumoniae, which is also known as pneumococcus. It is recommended that HIV patients get vaccinated in order to prevent infection with this bacteria. Symptoms for pneumonia include cough, producing mucus, a fever, chills, and trouble with breathing. Diagnosing pneumonia includes blood tests, a chest x-ray, the use of pulse oximetry to measure the amount of oxygen in a person's tissues, and a sputum test. To the right here, we have a chest x-ray that can show pneumonia in the lungs, and this white matter in the right lung will indicate pneumonia. Thank you everyone, and I hope my presentation provided you with some more knowledge on HIV and AIDS.